from CJ, who's the triage nurse, who does the same thing.
Okay, we're going to now get to this panel
I
of people
could go on and
with
on.
degrees after degrees.
I just want to let you
The real test for you is up here on this stage, because sitting right next to you is Dr. Andre Campbell. He knows a whole lot about waiting rooms and trauma rooms and all sorts of things to do with emergency care and deliverance of services. And so I'm going to ask our panel members if they would each take about a minute or so, because your resumes are fat and thick, to introduce yourself and tell us what it is that caused you to want to come out here and spend time on a sunny Saturday afternoon delivering the message that revolves around this efforts to make sure people get a delivery of service. So, Dr. Campbell, why don't you just start out for us, and then we'll move on down the road.
Those of you who don't know me, my name is Dr. Andre Campbell. I'm one of the trauma surgeons at San Francisco General Hospital. Some of you have been my patients, some of you have been my colleagues. But first thing I just want to say is that Peter, you did an absolutely wonderful job capturing the true spirit of what it's like to work in Highland Hospital, San Francisco General, Emory, all these other places around the country. You really have done, County USC. It is all very similar. The folks that I saw in that waiting room are exactly the people that I take care of every day. This morning I was rounding on patients. I saw 50 patients. I saw 5 major traumas. People shot up. You know, someone died this morning that I took care of. So these are really, truly moving and gripping stories, because they're the lives of folks who come to us for the help. But I've been working at San Francisco General Hospital now 19 years. It's really a fantastic place because of the people in the community and the folks in this audience who voted yes on Prop A. We will be around for another 100 years. We've been there for 100 years already. As you drive by Portola Avenue, you see our big hospital there, and we've struggled with this problem, honestly, of just to focus on what the movie is about, dealing with things. And actually, I saw some of my former medical students and residents, Doug White and Star Knight works with me, and a few of the other folks. They're really just fantastic folks. If you guys don't know, Doug is the tall guy with the deep voice and the beard. Doug was a fantastic medical student. He's a great doctor now. So it really is just an amazing story. But what we did at San Francisco General Hospital, when we saw a lot of these problems, we started a urgent care center. So we see 70,000 people in emergency services, and what we did is we took 30,000 of the folks who are not as acute, and we have them now go to the urgent care building, which is on Portola Avenue. So that helped decompress things a lot for us. I mean, our new hospital will have, right now we have 27 spaces. Wow, it's kind of echoing, sorry. I mean, to do 27 spaces, the new hospital will have 60. We can have an upsurge to 120. There'll be a lot more privacy than we have now. There'll be more trauma rooms, more space. So we're looking forward to the future, and in fact, there'll be a lot of great challenges with the Affordable Care Act, and I think later on we could talk about that and what that'll mean for us in places like San Francisco General Hospital and other places around the United States who have this. But once again, just revisiting, it is wonderful to be here, and yes, I worked this morning. I had to get up extra early and do it, but I wouldn't miss this for the world. It's just a wonderful movie. I'd never seen it before, and I just want to say it was really moving. It's inspirational. I mean, these stories are real people, and many times, you know, I saw a lot of my patients in this movie that I take care of every day, and these are folks in that community, folks who are here in our community that we take care of, and the challenges that we have about providing care in austere or resource-poor environments.
I'm going to ask each of you, would you just, the next person in line, introduce yourself. I know we have another doctor there. But I hope you take your programs home with you. You do need to read these resumes, but we're not going to make you do what you can do at home.
Did I take too long, Belva?
You were fine. Thank you.
Belva's back here cracking the whip. She's like, yeah, y'all just talk too much, you doctors.
Well, Dr. GINA. Yeah.
Thank you. Hi, can you hear me? Hi, I'm Dr. GINA Gregory-BURNS, and I'm thrilled to be here. I think that just coming together with all these fabulous people on stage and being honored to talk to you and have us all have this open conversation is something that I've talked to many of you about here in this room. So just be able to have the conversation about how to move forward, and especially with the Affordable Care Act, to be able to say, what can we do differently? What can we do differently to make a difference? I've worked for almost 25 years at Kaiser Permanente here in San Francisco. I'm an internal medicine physician, and aside from that, I see lots of patients who have all kinds of challenges. At Kaiser, we have many patients who still have lots of challenges. challenges, socioeconomic challenges, health challenges, not understanding exactly how best to take care of themselves or how to advocate for themselves, as we were just speaking about. My passion is also finding a way for all the groups here in the community to work together. I've been doing that for the past several years through Kaiser, through community benefits, and I think that having this conversation is a wonderful way to move forward, and I look forward to hearing how we can all work together. Thank you.
Hi, my name is Perry Lang, and I'm the Executive Director of the Black Coalition on AIDS, Rafiki Wellness, and also the Director of the African American Community Health Equity Council. That's a mouthful. I wear a variety of hats, but I'm really here today because it really had to be, because this is all about us. It's about the people sitting in the room. We have got to do a better job of taking care of our health. At BCEA, Rafiki Wellness, and we have information that we can share about what we do. But just to give you an example, we were together with 60 to 75 people this morning, exercising. Some people were biking. We have a Bike the Hood program. Some people were dancing. Then there was a nutrition program where people are learning about different foods and how to eat them. We have got to take charge of our own lives. And that's why I'm here today. If someone in this room, just one more person, can join that effort, I believe we're going to make a difference. I think overall, the two things that are most important to me is that we look and monitor the Affordable Care Act as it goes through to make sure it's working for all of us. And secondly, to take charge of our own lives. It's about prevention and wellness. It really is, and it starts with each of us in this room. That's why I'm here today, and I'm glad to be here. Thank you.
So my name is Andrea Tactol. I coordinate the Bayview Heal Zone, which is a healthy eating, active living project here in the Bayview. It's a Kaiser-funded initiative and a project of the Department of Public Health. And very much like Perry, I'm here because I'm a mother. I'm a mother of two raising her kids in the Bayview. And the health, when I was watching the movie, I was looking at all the patients, and those patients are, my neighbors, my family, my cousins, my friends, and the health of our community is so important. And so with the Bayview Heal Zone and some of the work that I've been doing, I'm here because we need our churches, we need our schools, we need our community-based organizations, we need just individual residents working together to make healthy eating and active living just a regular part of our lives. One of the organizations here in the Bayview, it's a youth organization. I don't know if you're out here, but they're the 3rd Street Youth Clinic. And they are working on a social marketing campaign to make nutrition, this is their slogan, is make nutrition our tradition. And I think that's so important for our communities, to make nutrition our tradition. Because it's not just about getting to the ER and being in the waiting room and getting service, it's about everything and all those opportunities before that to make our lives healthier and make sure that less of the people in our community are in the waiting room. So that's why I'm here. Thank you.
Thank you. We'll start on the other side. We might as well start right next to me.
Oh.
Hello, everyone. Nice to see you. Good afternoon. My name is Malia Cohen. I'm a member of the Board of Supervisors. I represent this neighborhood and a couple neighborhoods like Potrero Hill and Visitation Valley. I've come today to really to celebrate the good work of Pete. Thank you so much. And also to acknowledge the work that the service providers that are not only tabling, but also those that are hosting the links. Thank you so much for bringing this conversation to our beautiful Bayview Opera House, which is right here, the hub of a lot of the activity that happens in the Southeast. Also, I've got this, just bursting of seams at the seams of what we're doing as a city and a county from a policy perspective to address health disparities on the Southeast sector, not just the African American community, not just young people, seniors, but the entire health of the entire health of the community. So, thank you for inviting me. I'm happy to be here.
Thank you.
Good afternoon, everyone. I am so privileged to be here today. My name is Dr. Tony Rucker, and I am with the San Francisco Department of Public Health, and it's a great opportunity for me to be here, just to, first of all, my first viewing of this film, and it's just really just bringing home our families and communities. And as Perry was saying earlier, it's so important that we become advocates and participants in our own health and wellness. And from my vantage point, for the health department, from a policy perspective, just really identifying opportunities for each and every one of you, our community members, our family family members, the clients that we're serving, to actually have an opportunity to kind of help us and work with us in a very strategic way around working with our civil service clinics and programs that we have in the community, as well as our community-based organizations. In my role as Director of Health, Equity, and Workforce Development, we're working on many opportunities for really having all of our contractors and civil service clinics work more closely with you. We're working on an organizational cultural competency plan. We're requiring all of our clinics and providers to be able to develop pathways for you all, their clients, their community members, their neighbors, their family members, to work with them at an organizational level. This is an important policy pathway where we can have you all work more strategically and very much in a very plan focused way to ensure that you have a viable role in how our clinics and services are planned, how they are implemented, who's providing the services. And I'm sure you'll be hearing more about this. This is just underway with all of our contractors and clinics, and we're going to be reaching out to you to really transform the way we think about policy and service delivery in our clinics and programs. So we're excited about that, and we're just really looking for opportunities to work with you in a more collaborative, strategic manner. So we look forward to working with you so that we can reduce some of the inequities that we see in the film that we saw today. So thank you all so much.
And as we move the mic, there are cards that should have been on your chairs. If you have questions, start out, write them on the card.
I feel that I have a responsibility to help facilitate a discussion and a dialogue in the community about how we can promote health and prevention and wellness. And so that's my role, and I want to congratulate Peter. And as a former television news reporter, I was riveted by the storytelling and how you did that, so it's great. Thank you.
Good afternoon. My name is TAHIRA, BAZILE, and I work for the California Pan-Ethnic Health Network. We're a statewide nonprofit health policy organization representing communities of color. So I feel very blessed to be here today. I am in Sacramento every day trying to implement the Affordable Care Act, specific pieces of it as they impact our communities. And watching this documentary today really invigorated me. You know, I'm burning my shoe leather all day in the Capitol saying, what about us? What about folks that are in the waiting room? And sometimes that falls on deaf ears, so it's nice to get back into the community and say this is why I'm doing it, and to talk to you all about how you can kind of help me tell that story, because while I want to represent what's needed, I'm not in the ER as it stands. I'm not necessarily reflective of what is needed, and we need to hear your stories. They see me coming. Our legislators are like, oh my God, there's TAHIRA again. She's going to talk to me about communities of color and what they need and the disparities that exist, and they'll turn the other way. But when I bring you in there and say, this is me, I was there yesterday all day for diabetes, asthma, something that's preventive, something that with Medi-Cal expansion you can actually go to the doctor and treat and not go to the ER. We need it to happen, and it's not a rosy picture in Sacramento. So we need you all to help me push those guys to get this done. And I would love to actually ask if we could do a Sacramento screening at the Capitol, because they need it.
So, Belva's trying to keep the train on the tracks here, but I'm gonna. So we've had a bunch of screenings in Sacramento. Well, 3 I think. American College of Emergency Physicians, who've been an amazing partner. Organized a screening at the Crest. It's tough to get the engagement, to get those people that you're describing to these events, and that's the key, I think. And so we're gonna do more between now and October, and so we'll touch base after it. Yeah.